How can a simple suction cup transform your body's recovery process? Cupping therapy has been used for centuries, but what's the science behind this ancient technique? In this video, we'll explore how cupping works, the benefits it offers for pain relief and muscle recovery, and why it's becoming a popular choice in modern therapy. Although cupping has been around for quite a while, it really captured everyone's attention during the 2016 Olympics when Michael Phelps came out of retirement to bring home another 6 medals while looking like he lost a fight with a vacuum cleaner. For many across the world, and especially the US, this was their first introduction to cupping, and it has continued to grow in popularity since then. Now, there's a lot to unpack here, so let's dive in. Cupping therapy is an ancient technique where a healthcare provider puts a special cup on your skin for a few minutes to create a suction effect. The idea has always centered around the redirection of blood flow to different parts of your body, and it's used to address pain, inflammation, relaxation, or to generally promote overall well-being. Cupping is typically lumped into the category of alternative or complementary medicine, where the treatments tend to fall outside the scope of mainstream medical care, and they include things like acupuncture, Ayurvedic medicine, or energy work. The acceptance rates of these practices vary around the world, but over half of the adults in the US say they use some kind of alternative medicine to help manage their health and wellness on a regular basis. So if this applies to you, you're in good company. Cupping might be trendy now, but it's certainly not new. It dates back to the ancient Egyptians, and it remains an integral part of both Chinese and Middle Eastern cultures. One of the oldest medical textbooks in the world is the Ebers Papyrus, dating back to 1550 BC. It describes how the ancient Egyptians used cupping therapy to treat things like fevers, pain, vertigo, menstrual problems, and other ailments. They eventually introduced cupping to the ancient Greeks, and they basically used it as a cure-all for almost everything. Even their currency depicted images of the practice. It eventually found its way into traditional Chinese medicine, which makes use of several interventions like cupping, along with acupuncture and herbal medicine to manage the flow of qi across different meridians and balance the opposing forces of yin and yang. The Islamic prophet Muhammad also recommended the use of cupping in his teachings and writings, which he referred to as the practice of hijama. This continues to be the most widespread use of cupping today due to the strong association with Islamic traditions and how deeply ingrained the practice is in that region. Cupping was also pretty widely used in Europe and America until the 1800s, until the practice of medicine embraced the scientific method and it started to focus on treating illness from the inside out. Originally, cupping was performed with hollowed-out animal horns that were used to treat boils and suck out venom from snake bites. Eventually, the horns were replaced by bamboo, and then later by glass cups. No matter what was used, a suction effect was created by placing a small amount of flammable material inside the cup, lighting it on fire, and then extinguishing it on a person's skin. As the air cooled, it created a suction effect. You can still find providers who practice fire cupping, but most modern practitioners, like myself, either use a flexible silicone cup or a rigid plastic cup that requires an external pump to create the suction. Now, broadly speaking, cupping can be divided into 2 main types: dry and wet. Dry cupping is much more simple and is generally the preferred method in the West because it's easy to do and less invasive. The therapist applies a thin layer of lotion and then places the cups to your skin. Typically, the cups stay in place for 5 to 10 minutes, and it can be done as often as once or twice a week. Dry cupping may also be combined with massage, which is referred to as running cupping. This involves moving the cups over your skin to create a massage-like effect. The goals of dry cupping are really all about increasing circulation, but depending on who you talk to, they also supposedly remove fluids and toxins from the areas being treated. Wet cupping, on the other hand, is not for the squeamish. This technique usually starts with a brief application of a cup, and then after a few minutes, it's removed, and a small scalpel is used to make tiny, shallow cuts on your skin. Then the cup is reapplied for another 10 to 15 minutes, so they can draw out a small quantity of blood. After the treatment, the open wounds are treated with an antibiotic ointment and then bandaged to prevent an infection. The idea of this approach is that those cuts attract inflammatory cells and also cause the release of natural pain relievers and mood enhancers called endogenous opioids. These are also known to help your body fight off infections and maintain immunity. However, because of its invasive nature, wet cupping is usually recommended no more than once or twice per month. I consider myself to be an evidence-based practitioner, and that means that I will only use a treatment if it has been shown to be effective in the literature. And I'm also very wary of any intervention that studies have shown to be ineffective. So, what does the research tell us? Well, unfortunately, you have to be a pretty savvy consumer to draw any firm conclusions. There are several published articles out there that support the use of wet cupping for treating things like nonspecific low back pain or even Bell's palsy. And if you're someone who's gotten wet cupping before, I'd love to hear about any success stories in the comments section if you're willing to share. But the general consensus seems to indicate that bloodletting really has no place in the management of myofascial pain. So let's just push that one off to the side. Surprisingly, however, therapeutic phlebotomy is still a widely accepted medical practice for treating a few diseases, but those are very specific conditions and it should only be performed under the supervision of a licensed physician. The practice of dry cupping, on the other hand, might just hold water. There are dozens of high-quality studies out there that have shown cupping to be an effective treatment for addressing myofascial pain, but there are many others that have reached the opposite conclusion. And an important question that most of these studies don't answer is, how does cupping compare to other treatments? When compared to other interventions like kinesiotaping, dry needling, or other manual therapy techniques, it consistently fails to outshine any of the competitors. So without that full-throated support from the available body of evidence, you're never going to see me use this as a standalone intervention. That being said, I do find myself using cupping on my patients quite frequently. When appropriate, it can be very effective at breaking up scar tissue and releasing other fascial adhesions. There are many soft tissue mobilization techniques like cross-friction massage, strain counterstrain, Graston technique, ischemic release, the list goes on. But cupping is unique in that it's the only tool that allows me to mobilize tissues with negative pressure. By lifting the skin away from those underlying tissues and combining it with active movement and dynamic stretching, we can get some pretty incredible results. This approach is also referred to as dynamic cupping. But everybody wants to know, what about the bruises? Well, unfortunately, that's usually part of the package. But these bruises are significantly less traumatic than a bruise from an injury, where many of the underlying tissues have been damaged. Cupping, on the other hand, increases blood flow to the capillary beds, causing them to expand and eventually break open. And it's the blood seeping into the skin that gives you that oh-so-attractive shiner. But you have to remember that our capillary beds are made of blood vessels that are so thin that blood cells pass through single file and that gases are able to diffuse right through the capillary walls. So it doesn't take much for you to spring a leak, internally at least. And believe it or not, the degree of bruising can tell you a lot about how good the existing blood supply is. Almost every person I have treated with cupping tends to show less discoloration with each subsequent treatment. That's a pretty good sign that we've managed to improve the circulation in that area, because all of that micro trauma causes your body to replenish that area with a healthier amount of blood flow, and it stimulates healing at the cellular level. So if you're asking for my 2 cents, cupping can absolutely play a role in decreasing pain and improving overall mobility. But if you're trying to figure out whether this is right for you, well, that really depends on a lot of individual factors. And there are several reasons to avoid cupping, such as if you have a bleeding disorder, or if you're taking anticoagulant medications, if you have excessive swelling, or if you have an open wound, or if you have any dermatological issues like eczema or vitiligo. But generally speaking, the worst side effect is usually just a hickey, and ultimately, this is another great example of a low-cost, low-risk intervention that has been shown to be helpful for treating a wide array of conditions. And if you're still not sure whether it's something you should try, then don't be afraid to ask your physician or your physical therapist. Thanks for joining us today. I'm Stephen the PT Doc, and I hope this helped.